Hello students, welcome to my channel. Here we will study about pharmacology. Starting with the pharmacology, first we will understand the roots of drug administration. So here is the classification of first is systematic and tropical or local. Systematic includes the administration of the drug directly into the body, that is orally, sublingual or rectal, and local or tropical is application of the drug on the outer layer of the body, that is skin, mucous membrane, etc. And now we will see here enteral. Enteral. What do you mean by enteral and parenteral? Enteral. Enteral is administration of the drug through oral cavity, sublingually, or rectally. Parenteral means introduction of the drugs through injections, inhalations, or transdermal. So here is the enteral routes: oral, sublingual, and rectal. Oral is most commonly used and the oldest and the safest route of drug administration. As you all know, most of the drugs are taken through oral route. So it is the most common and safest route of administration. The larger surface area of the gastrointestinal tract, the mixing of its contents, and the difference in the pH at different parts of the gut facilitate effective absorption of the drugs given orally. Here it is introduced into the oral cavity, it goes into the GIT, and here the mixing of the contents takes place with different pH at the different part of the gut, which facilitate the effective absorption. So it helps in absorption. However, the acid and the enzymes secreted in the gut and the biochemical activity of the bacterial flora of the gut can destroy some drugs before they are absorbed. So here comes the disadvantage also. The acids and the enzymes which are secreted in the gut can have the ability to destroy the drug. So it can be sometimes not useful route. So here are the advantages. Safest route, most convenient, most economical. Drugs can be self-administered. And disadvantages, that is slow action, which is onset of action is slower as absorption needs time, hence particularly not suitable for emergency. So there is, in case of emergency, we can't use the oral route. There is poor absorption, GI irritation, and unpredictable absorption. So there may be disadvantages, that is poor absorption. Then some drugs may get destroyed in the GI, which can be cause poor absorption. GI irritation, some may lead to irritation of the GIT, and there is no predictable absorption. Some may get absorbed, some do not get absorbed. So these are the disadvantages. Now we will see sublingual route. Here the tablet or the pellet containing the drug is placed under the tongue. यहाँ पे हमारा जो टैबलेट है वो टंग के नीचे प्लेस किया जाता है. As the drug dissolves, it is across the sublingual mucosa. Example nitroglycerin, nifedipine, buprenorphine. यहाँ पे जो ड्रग है वो सबलिंगुअल म्यूकोजा में डिसॉल्व होता है. इस फॉर्म को ऐसे डिजाइन किया जाता है कि वो सलाइवा में अच्छे से घुल जाए और अपने बॉडी में अच्छे से एब्जॉर्ब हो. द बकल म्यूकोजा इज रिच इन ब्लड सप्लाई. जो बकल कैविटी है और बकल म्यूकोजा है वो रिच इन ब्लड सप्लाई है, वहाँ पे ज़्यादा ब्लड सप्लाई होता है, तो वो इजी है ड्रग एब्जॉर्ब होने के लिए. तो यहाँ पे एडवांटेजेस है. एब्जॉर्प्शन इज रैपिड, जल्दी एब्जॉर्प्शन होता है. जैसे ही हम प्लेस करते हैं ड्रग, विद इन 5 to 10 मिनट्स यहाँ पे ड्रग एब्जॉर्ब हो जाता है. फर्स्ट पास मेटाबॉलिज्म कैन बी अवॉइडेड. फर्स्ट पास मेटाबॉलिज्म इन्वॉल्व्स लीवर में ड्रग नहीं जाएगा और वहाँ पे ड्रग डिस्ट्रॉय नहीं होगा. Disadvantages, buccal ulceration. Ulcers can be occur in the buccal cavity. Insoluble drugs of higher molecular weight, irritant and unpalatable drugs cannot be given by this route. लिपिड soluble ड्रग है, जो हाई मोलिकुलर वेट की ड्रग है और जो इरिटेंट ड्रग है और जो अनपैलेटेबल मीन्स जो ड्रग जो हमारे बकल म्यूकोजा से नहीं सूट होंगे, वो ड्रग हम इस रूट से नहीं दे सकते. तो ये एक बड़ा डिसएडवांटेज है. नाउ वी विल सी रेक्टल रूट. Rectum has a rich blood supply and can cross rectal mucosa. To be avoided, absorbed for the systematic effect like indomethacin, chlorpromazine, diazepam and paraldehyde can be given rectally. Some irritant drugs are given such as suppositories. तो रेक्टम जो है वो ब्लड सप्लाई में अच्छा है एंड कैन और वो रेक्टल म्यूकोसा में एब्जॉर्ब हो सकता है।